Welcome back to Ladies of Another View. And I want to quickly welcome back our guest, Dr. Elinore McCance-Katz, who works in, she's a psychiatrist, she's a teacher, she works, educating people and letting people know about the shortage of hospital beds for mental illness, working with veterans. And one thing I just want to point out to people, because we ran out of time, is that to think about why do we need to care about mental illness? My family's fine, this is not an issue. It's an issue for everybody, because if you will look back, I think it was in August, where there was the stabbing on the subway with the beautiful young lady from Ukraine, Irina, and she was stabbed by DeCarlos DeJune Brown Jr. And I heard people saying, "Oh, it's ridiculous. He had 14 prior commitments. What was he doing?" Or convictions. Yeah. What was he doing out on the streets? Okay. Do we put him on the street or do we put him in prison? Because he was a paranoid schizophrenic. His mother knew he was dangerous. She tried to get mental help, treatment for him. There were no rooms. This wasn't, some people say, oh, it was a racist thing because he said something about the white woman. That guy was crazy. He was a paranoid schizophrenic. He could have done anything to anybody. He needed treatment. His mother wanted to get him treatment, and there was nothing there. This is why this absolutely needs to be addressed in this country. And so I just wanted to say that because we ran out of time for the last segment. But Lori, I know you had a question.
No, so I understand like where we're at now. We're just seeing more mental illness, more people getting into drugs, more homelessness and things like that. And my thing is we're at, we do need to work on that and what people to do now. But my thing is always about educating people. Like you had said that we have such a high increase now after the pandemic, like in 2020, when people are isolated at home, they're not meeting with people, they're not having that interaction, and it leads to substance abuse. They're not getting out in the sun, and it's like those vitamin deficiencies, all of that. And then if there's anything in their history or anything like that, they can be more vulnerable to mental illness or anxiety, depression, things like that. So with how people are now with mental illness, but the education factor of how to avoid that slippery slope, would you say that's super important?
Oh, it's very important. It's really so important, and it needs to start, by the way, with our kids. Really, it's important for children to learn about what a healthy lifestyle is. What's good nutrition, what's a good diet, what's healthy kinds of activities. We know also that social media is really damaging for many people, and especially for our kids. These are the kinds of issues that people need to know about from an early age and going forward. And the fact is that we have a lot of people struggle with depression and anxiety. The case that you're talking about with the unfortunate killing of Irina Zarutka in Charlotte, North Carolina, was a result of somebody who had a psychotic illness. And so there are also signs that sometimes, in fact, very often start in adolescence. And so it's important for parents and for adolescents to know what the signs and signals of mental health problems, crisis are. So yes, I agree with you, and I think it should start early.
Well, I have a question for you. It's a little bit different. And, I also think it's important to bring in the piece about, emotional healing and health and wellness. But when we're talking about this, what are your thoughts on like homeopathic care and natural products and remedies? Like, have you heard about some of the mushrooms that they've been utilizing for some of these more psychiatric patients? Have you heard or much about that, or what's your thoughts on it?
So my thoughts are that there definitely has been shown to be a role for a drug called ketamine. Ketamine is a medication that is used now for what we call treatment-resistant depression. So people who've not responded to other types of interventions for depression sometimes do very well with ketamine. And ketamine is what is called a hallucinogen type of drug. It's the most common feeling that people will get when they take it is kind of we call it dissociation, kind of an out of body experience, but it's been shown to work fairly rapidly to help people with very serious depression, but it's not for everyone. So I think that what's important to know about ketamine and other drugs like mushrooms and the like is that these are drugs that have been around for a long time and abused. I mean, hallucinogens have been around since the 1960s. You remember Timothy Leary and LSD and all of those events of the past. And so these are drugs that definitely can be abused, but these are drugs that probably also, for some people, have important therapeutic potential. And so I think those medications need to be explored and they need to be available for people that can benefit from them, but we do have to regulate them. We have to do our very best to keep them out of the hands of people that would misuse them, particularly children whose brains continue to develop until they're age 25. And we have evidence, for example, with cannabis, marijuana products, that kids are at special risk for developing psychosis and depression with use of that kind of drug. So we want to make sure that if we're going to make these treatments available, treatments that we know from our past history have been misused by a lot of people, we have to put guardrails in place so that we can safely use these medications for people who need them and keep them out of the hands of young people and others that might be harmed by these drugs.
So we have less than a minute now, and I wanted to talk about veterans, which, I always have to have my guests on again because we always have so much to talk about. Because there's a large, you work with them on opiate abuse, and I imagine PTSD and homelessness. Just very quickly, what's the biggest factor you deal with veterans, and so that people can be a little bit more compassionate and aware of what's going on with them?
So a lot of the veterans that I've worked with are people who have been deployed and been in war zones, combat zones, and they've been injured. And they get to me because they were treated with opioid analgesics, so pain medications, while they were in the service because they were injured. They were discharged from the service that they were in because of their injuries, and they would get to the VA system, and often they would be very quickly tapered or maybe not tapered at all from their opioid analgesic. That causes them to have painful withdrawal, and so some of them become addicted to street fentanyl at this point. It's very dangerous. It's very it's a very big problem because it involves the need to educate practitioners on how to safely use these medications in veterans who need them, and when the time comes to get them off of these medications, how to safely do that. There are ways to do that, but if you don't do it in a safe way, the person is at very high risk for developing addiction. And then they get to a person like me who then works with them to try to treat their addiction. At the same time, with veterans, they very, very often have frequent co-occurring mental health conditions like PTSD because of some of those very difficult experiences. So it's a group that really deserves our very best care, and we need to, in my opinion, do more to help them.
Dr. McCance-Katz, I would like to do another show with you where we just talk about our veterans, because I feel like we barely scratched the surface. To help people understand what is PTSD. It's been about 4 years. I did a special on that once before, but I will definitely be in touch with you. We'll talk more about this, but thank you for coming on today.
Thank you, and happy holidays.
Yeah,
Same to
yes,
you.
Merry Christmas, Happy Holidays.